All right, well, I've just hit 100 people logged on, so it might be a good time to get started now. If you're just joining us, welcome to our second Breathe Better class, Breathing in Cold Weather. My name's Karen. I'm one of the staff at Asthma Australia. Joining me tonight is our presenter, Janet Bondarenko. So Janet, if you can pop your camera on if you're ready to go. This is our second webinar in a series of 3 Breathe Better classes that we're planning on holding this year. The class will be recorded and you should receive an email with the link in the next day or two after the webinar. For those who don't know, Asthma Australia is the peak body for people with asthma in Australia. As our name suggests, we're nationwide, so we represent most of the states of Australia. We also have a website with asthma information and a phone line, so 1-800-ASTHMA or 1-800-278-462, where you can speak to an asthma educator if you'd like some personalised information. This class will go for about 45 minutes and we've got lots of time, as I said, at the end for questions. If you think of questions during the class, put them into the questions box of the sidebar. Some of them I might be able to answer via the questions function, or I might redirect you for a chat with one of our asthma educators, but otherwise we'll try and get through as many as we can with Janet at the end. We also do have a survey for you to complete after this webinar, which is really important to us. It helps to plan our future webinars, our future content, and we do really read all of your responses. I'm going to pop the link in the chat now, so if you do need to leave early tonight, you can just try and complete that for us before you go. It doesn't take too long. So you should be able to see it there in the chat now. As we get started, I just want to acknowledge the lands we're all meeting on today. The traditional custodians of the land on which we're meeting, pay my respects to elders past, present and emerging. And I extend that respect to all Aboriginal and Torres Strait Islander people that might be joining us tonight. I'm meeting on the Yagara land north of Brisbane, which I'm sure is a bit less cold than where a lot of you are right now. Janet, where are you joining from?
I am from the land of the Wurundjeri and the Kulin clan, so in Melbourne.
Lovely, thanks Janet. So Janet's going to take us through this Breathe Better class tonight. Janet is a senior respiratory physiotherapist at the Alfred Hospital in Melbourne. Physios specialising in respiratory are a bit hard to come by, so we are very lucky to have her. She has extensive clinical experience in the management of chronic respiratory disease. She currently coordinates the pulmonary rehabilitation program and the outpatient physiotherapy clinic at the Alfred Health. On top of that, she is a PhD candidate researching the characteristics and treatment of dysfunctional breathing in asthma. So extremely well qualified to talk on this topic. The topic tonight around airway clearance is an area where you really do need some specialist input from someone like Janet. These exercises aren't exactly one size fits all, and it can be hard to find a physio with the right specialty. So again, we're really excited to have Janet speaking on this topic, but ask your doctor to refer you to someone local so you can get a personalised plan if it looks like this might be right for you. So Janet, that's enough for me. I will hand over to you, hand you the reins.
Okay. Thank you. So have I got control? Yes. All right. All right. Is that advancing? No.
No, Janet, give me a second. I'll reset up the...
Oh, okay. I was going to say, if you want to advance the slides, that's fine as well.
There you go. That should be over to you now, but I can do it if that's easier.
Okay, it looks, all right. Well, thank you to Asthma Australia for asking me to talk about this, and it's sort of good timing while we're in this quite cold weather already at the moment in Australia. And so essentially what we'll talk about today, next slide, thanks, Karen. will be around how cold air affects your breathing, because it can have quite a substantial effect on how you breathe. How to clear some of the mucus from your lungs and also your upper airway. So your upper airway are things like your sinuses, and because we tend to collect a lot of extra mucus in our sinuses as well. We'll go through some demonstrations of the technique. So hopefully you're somewhere where you're comfortable, can be sitting comfortably or lying down, or somewhere where you can actually just sit supported and be relaxed and practice some of these exercises as well. Then just some general tips around managing, your lung disease in winter, and then we'll have lots of time for questions hopefully as well at the end. So pop them in the chat and we'll do our best to get through as many as we can. So next slide, thanks. So cold air, and how does it affect our breathing? And it sort of is a double whammy of the dry air and also the cold air. So the dry air, what that does is it sort of irritates and dehydrates the inside walls of our lungs. So it's normal inside the lungs to have a little bit of mucus, and it moves throughout the day. But what happens when dry air hits that sort of mucus membrane is that it dehydrates the airways and it makes the mucus really thick and sticky and hard to clear. And then on the other hand, you've got cold air, which causes all the lung muscles around the sort of airway wall to go into a bit of spasm. It's a bit like an allergy in the lungs, causes those muscles to spasm. And so as a consequence of the combination of that cold and dry air, you've got that restriction in the airways plus extra mucus. It's harder to get air in and out of your lungs, so you feel short of breath. And then you've got this increased mucus and coughing. And that can then lead to further chest infections. So those are sorts of things that we want to try and avoid. So next slide, thank you. So why is it important to clear mucus from your lungs? And the number one reason is that it will make your breathing a lot easier. So if you can clear that excess mucus that's blocking some of those airways, you can get more air into your lungs and it's easier to get air in and out and you feel better. It can reduce some of those coughing fits. So some people get a bit of mucus, find it really tricky to clear it, and they get into these big coughing fits that are just exhausting. And so clearing your mucus on a regular basis can help reduce having those coughing fits. It also reduces the risk of getting infections. So mucus, if it's on the move and you're constantly clearing it, it's not too bad, but if it sits there and it's allowed to pool, that's often when the infection can develop. And the more infections that you can get further damage to your lungs. So it's important to clear that mucus so that you can minimize some of that further damage. And for some people, mucus is really only a problem when you've got a chest infection. So for some people here, you might think, well, actually, I only need to do some of these things once in a while when I get a chest infection. But for other people, it's a problem every day. And you find that you're clearing this sort of excess mucus every single day. So it might be something that maybe potentially you need to do some sort of airway clearance technique a bit more frequently. And mucus is much harder to clear when you have any sort of lung disease because your lungs can be constricted, so it's harder to move the mucus along. Or you might have lost some of the elasticity in your lungs if you've got something like COPD. And so again, it's very difficult to clear mucus when you've got lung disease. But there are some things that we can try, and we'll go through some of those. So next slide, thank you. So these are just some of the really top three sort of techniques to move mucus from your lungs. And number one is exercise. Number two is some simple breathing exercises and huffing. And then moving on to the different sorts of devices that you can use to help clear some of those excess secretions. And so I think it's important to note too that mucus is actually quite normal. So all of us have mucus in our lungs. We've got this sort of mucus lining, and it does protect your airways. So it collects a lot of the foreign particles. There's also a layer of immune cells. So it's important to have mucus, but most of us, it will move throughout the day. We get up, we get moving, we might talk, go for a walk, etc. And the mucus moves along. But it's a problem when it just sits there and pools. And what we also see moving mucus is that the mucus sort of starts in this picture here. You can look like your lungs are like a tree, an upside down sort of tree trunk, and you can see those branches and those buds, and those are those really small airways in your lungs, and that's where the mucus starts, and it often blocks in those small airways. So clearing mucus is this process of getting it from those little small tree buds into the next, small airways, and then up into the bigger branches, and then up into the very large, your large windpipe, and then being able to cough and clear. So coughing only works when you've actually moved that mucus already all the way up to almost near where your vocal cords are. So sometimes we feel a tickle in our chest and we want to cough and just think, I'm just going to cough this out. But actually coughing only works when the mucus is already, it needs to be quite high. And so continuing to cough and cough and cough when the mucus isn't sort of quite ready to come yet can probably do more damage than is good. And so all these sorts of techniques that we'll talk about today, it's again this process of moving the mucus from those small little tree buds all the way up to then when you can huff and cough it out. Next slide, thank you. All right, so we'll start with exercise because this is probably a really important technique, and it's quite, most people can sort of do some exercise, and I think a lot of people find that after you've done a little bit of exercise, you often feel a bit clearer, your lungs feel a bit open, and that's what it does, is it helps to clear mucus by increasing the airflow inside the lungs and then loosening it from the walls of the airway. So if you think of it a bit like a stagnant pond or a lake, like a big body of water. And when it's a still day and there's no wind, the pond is very still and the water is very still and not a lot happens. And that's also a good analogy. The algae grows and bugs can grow in that sort of environment. But when you've got the wind or you've got some water filtering through there, and you can, if there's a big gust of wind, it pulls up the layers of the pond or the water, and you can see ripples and waves, etc. And that's what sort of exercise does inside your lungs. So it's that airflow, it's providing that sort of wind inside your lungs to help shear that mucus away from the airway wall and then shift it so you can actually then cough and clear it. But it's important to exercise at the right intensity. So we've got on the right hand here what's called the modified Borg dyspnea scale, which is basically a scale to rate how breathless you feel. And it was developed by a fellow called Borg, which is why it's called Borg. And really doing exercise sort of where you feel not short of breath at all or very, very slight shortness of breath, that doesn't give you that much benefit, but consequently pushing yourself to the point where you're feeling severe breathlessness, very severe breathlessness, again, that doesn't give you any added benefit as well. So really you just want to feel this sort of slight to moderate huff and puff. That's the perfect intensity. Then you know that you're working hard enough but not too hard to get that benefit from exercise. And some tips to do, especially in winter, as a warm-up, because it is, especially if you're maybe going for a walk outside, it's important to warm up before you do any of those things. So some stretching inside or walking on the spot or just getting a bit more blood flow to your muscles before you start your exercise. If you've been prescribed any preventers before you exercise, so making sure that you take them before you exercise and maybe carry them with you as well if you're going outside. Stay hydrated, so don't let yourself get dehydrated when you're doing exercise. And in winter, try to avoid that sort of early morning, late evening, the coldest sort of parts of the day. And starting exercise can be daunting as well. And if you feel like you'd need a bit of extra support to start an exercise program, then it would be worthwhile considering joining a local pulmonary rehabilitation program. Thanks. Next slide. Thank you. So the next technique we'll talk about is what it's called huffing. And this again, if anything, if you can learn one thing from tonight, I think this would be it. So this is a really simple technique, but it's to clear the secretions more from your sort of upper airways. And we spoke before that coughing only works when you've really got the mucus up quite high. But also it's not really that effective for people with lung disease, because we find that when your lungs are have lost their elasticity or things like that, as soon as you cough, the airways tend to sort of collapse down on themselves a little bit. So huffing is a really good alternative. It's less stressful than coughing, and it prevents those airways from collapsing. So what it does is it moves the mucus again up a little bit closer to your mouth, and then that makes it easier to clear. So this is a technique that you can use just purely on its own when you feel like you've got a tickle there and you feel like there's something to clear, or it's also something that we use with every single airway technique that we would ever teach someone. So huffing is involved in anything and everything, and I think it's really important technique for anyone with lung disease to learn. So we'll practice it now while we're all here. So just getting comfortable, relax your shoulders, relax your jaw, and what we're going to do is just breathe in through your nose and slightly bigger than normal. You're going to make an O with your mouth and relaxing your throat and jaw, and then you're breathing out. And what we want to get from that is about this flow. So we don't want to force the air out, so it shouldn't be like a don't know if you can hear that. You can get that wheeze at the end. That's airway collapse. So it's not about forcing air out. It's about getting this lovely flow through your throat and then out through your mouth. So you can imagine that you're fogging up a mirror, or you can also use, like in this picture, those are sort of some of the cardboard tubes that we use in the lung function lab, or I've got some plastic tubing sometimes I give to patients as well. And all this does is help keep your mouth open in that sort of O position and help you keep everything relaxed. So you can use something like a tube as well, just to, again, breathing in and then getting that nice flow out. To check that you're doing it properly and you're getting some flow, I'll try, hopefully this works on my camera. And you can even try blowing like a tissue. So you want to get that flow so the tissue is blowing. Like that. So you can see if you go too quickly and too hard, I'm not getting a lot of the tissue movement. So we want that nice flow. So just practice that a couple times. Don't do too many of them, because if you do too many of them, you'll get quite dizzy. We just say do 2 or 3. And if the mucus isn't there or not coming, then we go back to doing some different breathing exercises. It just means that it's not quite high enough yet to cough and clear. So again, a huff is really important, but just do 2 or 3 at a time so you don't get too dizzy and hyperventilate, and then rest, and then hopefully cough and clear if it's there, but if not, then going back to doing something to try and move it a little bit closer to your mouth. All right, and next slide. Thanks. So this is what's a breathing technique that's called the active cycle of breathing. And what it is you're using different depths of breathing to move that mucus again from those tree buds all the way up to the larger airways, where then you can huff and clear. So there's 3 components to this sort of breathing technique. And the first one is called breathing control. And this is really just the resting part of the cycle. So it's about you sort of preparing yourself to do the more active parts of this cycle. And really it's just around, again, relaxed breathing. So relaxing your shoulders, your neck, your jaw, slow breathing into your nose and your stomach, and then out again. So it's not really big breaths. It's just normal volumes and just thinking about resting. So we're doing that to prepare ourselves for the next part of the cycle, which is called thoracic expansion or deep breathing. And this is where we're doing this big active breath in. So we want to slowly fill in your lungs. So you're breathing in through your nose slowly until you've sort of filled your lungs up with as much air as possible. And you can even pop your hands on your side ribs and feel them expanding as well. As you're taking that slow, deep breath in, and you keep filling until you can't feel anymore. If you're able, you can hold it for a second or 2. If you're not able, that's fine as well. And then it's really just around letting it go through your mouth. So again, I'll demonstrate. So slow breath in, filling up, holding, and then letting it go. And when we talk about letting it go, it's like letting go of an elastic band that you've had a big stretch. So if you think of your lungs like a big elastic band, when you're taking that nice big breath in, you're stretching the elastic band, and then you're just letting it go like you'd let go of that elastic band, and it should just spring back. So you're and letting your lungs go back again. And so doing 3 or 4 deep breaths like that, and then going back into your breathing control again, resting, recovering for as long as you need, so 10, 20, 30 seconds, and then back into 3 or 4 of these big deep breaths. So big breath in and hold and letting it go, and another one. And holding and letting it go. And then more of the breathing control. And then try and do 2 or 3 huffs, and only coughing if you feel like there's something there ready to come up. And so the time that you spend in each sort of component of the cycle will really depend on your needs as well, and that might be something you might want to discuss with a physio or something, or with your healthcare clinicians. For some people, they need to spend quite a lot of time in breathing control than just doing, say, 2 deep breaths. Other people might want to do up to 6 deep breaths and then into breathing control as well. So the time that you spend in each cycle is very individualized, and you're sort of doing this cycle, repeating it until you're feeling clear. So it could be 10 minutes, it could be 5 minutes. Again, it's something that sort of we often individualize that sort of prescription. But this is a really nice technique because it can be performed anywhere. So you're just doing breathing exercises that are very portable. So you can do it. Some people like doing it in the shower as well in the morning, so getting that steam and some humidification. If people do nebulizer therapy, they might do it while they're inhaling their nebulizer. So it's really quite portable, and it can be used in a variety of different settings. And you can also do it, so you can do it sitting upright, you can do it lying down if that is more preferable, depending on where you feel like you've got the mucus as well. But it's quite an effective technique. And next slide, thank you. And so one of the other things that we often do prescribe to people are devices, and these are really more for people who have quite high sputum loads and need to use something on a daily basis, and things like breathing exercises and just general exercises are still sort of not enough to clear that excess mucus. So they're certainly not appropriate for everyone, and they can be quite expensive. But I think the most important thing is that you're taught how to use any devices correctly. So it's very much like a prescription drug, that you wouldn't just give it to someone and say, here, take this. You give someone a prescription in terms of how many breaths they would take into it. Technique is really important as well, so having the correct technique. So I've got a few of them here, so I thought I might as well demonstrate some of them for you and how they work. So essentially what they're doing is they're stenting open the airways using what's called positive pressure, so positive expiratory pressure, which is where the PEP comes from. So when you blow into some of these devices, it sort of gives a back pressure into your lungs, and that back pressure holds the airways open so that you can then get some more air behind the mucus, and it can come up closer and then you can clear it. So there's different types, which we call oscillating PEP, which are the ones that use a different frequency of expiratory pressure. And then there's ones that just have very straight pressure. So the first one on the screen is this device here, and it uses more oscillating pressure. So what you're doing is you're breathing into it, in and then out. And you can kind of hear those vibrations that are happening. So that's the oscillating pressure inside the airways. And what that does, again, is keep the airways open, but it sort of shakes them a little bit to move some of those secretions, again, up and then out. So these are the sort of things that we would prescribe certainly for, and we would set the setting for it. So you're on the right intensity, but also how many breaths you're going to do through it, how many cycles, etc. And again, being taught how to use it correctly. So for this particular device, you need to breathe in through your nose, hold for a couple seconds, and then blow out. Where some of the other devices, we want you just to continuously breathe in and out. So that's one of those ones. This green device here is very similar to the one I just showed before, just a different company. So it's, again, using the oscillating pressure. And then we've got a device that just uses straight positive expiratory pressure. It's got a dial on it, so you can set the pressure that you want. And again, this is why it's so important to get this prescribed and assessed, because what we often do is assess patients for the most accurate pressure for them based on their lung disease and the flow that they can achieve. And so we don't want to set a pressure that's too high, because that can actually be quite damaging for your lungs if you've got too much expiratory pressure. And again, we don't want it too low as well. So we actually have a little device that we would connect this to when we see patients, so that we can actually measure the amount of PEP that you're getting when you're doing this, and then we can actually accurately prescribe and set it for you. But essentially, you're breathing out against a pressure, and it's just a and I've just realized I've demonstrated incorrect technique for that one. So you actually need a really good lip seal, and you should really only just be breathing in through your nose and out through your mouth, and keeping a really good lip seal on this one. So sometimes often we'll get nose clips as well. So we've got some lovely nose clips that we can pop on people, so that we just keep this circuit through with a good lip seal, in, out. So it works in a slightly different way than the other devices. And again, very effective, but it's important to choose something with an expert who can choose a device with you and then teach you how to use it. And then lastly, we've got these flutter devices. They often are under different names depending on the company that sells them, but essentially they're just like a little pipe with a ball bearing inside them, and they're very similar to the first two devices that we looked at. So when you blow into it, the ball bearing goes up and down and gives you those oscillating vibrations in your chest. So the tricky bit with this one is that if you have it at the wrong angle, it doesn't necessarily work correctly. So if it's too far down, you're not going to get that sort of oscillation. So you've got to hold it at the right angle. And then again, breathing in, hold, and then out. And one of the simple ways to do positive pressure is blowing bubbles. So this is something that we probably use a lot, maybe more on the ward for people who are inpatients who have a bit of chest infection. Some people use this at home as well. So essentially just getting a bottle of water, and the height of the water in that determines the amount of pressure that you're putting into the expiratory flow. So sort of only, you only need a little bit of water in it. It's the height, and then some tubing and blowing bubbles. So again, that's a really simple technique, but can be quite effective. But again, it's useful to be taught how to use these things properly, making sure that they're on the right settings for you, and that you've got an individualized prescription so that it does work. Next slide, thanks. So the upper airways and your sinuses, and these are really important because nasal congestion is really common in people with lung disease, and it can lead to the increased risk of chest infection. So we know often that sometimes an infection might start up in your sinuses and then it heads down into your chest as well. And also that breathing through your nose is so important as well. So it's really important to keep your sinuses clear. And there are some simple things that you can try. So things like your nasal sprays. Really important though that these sort of like saline sprays would be used before any of your medicated sprays. So if you've been prescribed something like Nasonex or another type of sinus spray, that you would use the saline first. So we get the saline in, flush out anything, and then use your medicated spray. So the last thing we want to do is sort of flush out your medications. So do the saline first and then your medicated spray. And technique is really important as well with any of these sort of nose sprays. So just like technique is important when you're doing any of your inhaled medications, it's the same thing with saline. So you want to sort of tip your head down just a little bit, and you're sort of spraying in a V to get up into the sinuses. And then for sort of a more larger volume irrigation of your sinuses, we can look at some nasal irrigation. So these are things as well that you can purchase just from the chemist. We've got the neti pot, which is the one on the left-hand side, and that's more of a low pressure irrigation. So if you're someone who gets ear infections or you're really blocked, the neti pot doesn't have as much pressure. So it can be a lot gentler to your sinuses to flush them out. And then there's the ones in the bottles, which are more of a high pressure system that flush out a lot of the secretions as well. So those can be really, really effective, simple techniques to try. and just making sure that you're boiling the water and letting it cool before you use any sort of nasal irrigation so that it is sort of sterile. And another thing to try, and actually I haven't put it on the slide, but something that there is a little bit of evidence that it does help is humming. So things like just humming to yourself, so can create some vibrations in your sinuses and help to loosen some of those secretions as well. So you could also try that. Next slide, thanks. So keeping your airways hydrated and humidified is really important in winter because this is what the normal mucus clearance relies on. So like I said before, all of us have mucus in our lungs, and how we move mucus depends on the temperature and the moisture levels in the airway. So optimal mucus movement starts when you've got a temperature of around 37 degrees and humidity above 50%. So on the right, there's a picture sort of your airway layer. And on the top layer, so that orange bit, is sort of this normal mucus layer. And what that does is it contains immune cells and it traps a lot of those foreign particles, and it's got quite a lot of water in it to keep it bouncing. So below all that, you've got those sort of hair-like structures, which are called cilia. And what they do is they're like little sweepers, and they sweep in waves. And so they're really, really important at moving all that mucus through your lungs. And what happens when your airways get dehydrated is that top layer of mucus gets a bit sludgy, heavy. It can collapse down on the cilia so that the cilia decide not to move so much. But also the dryness just affects the cilia themselves, and they lose that lovely wave-like sort of sweeping action. So it's really important to keep your hydration up, and also not too humid, but a good normal humid environment. So things that can decrease your airway humidity are things like having an infection. Anyone who uses oxygen therapy, so having the oxygen can actually dehydrate your airways as well. In winter, it's more the heating, so all of the dryness in the air and the heating can cause some decreased airway humidity. And then just in general, the cold and dry air. Next slide, thanks. So some simple things that you can do just to try and increase the humidification and hydration. The simplest thing is to try and breathe through your nose. So your nose is a really important part of your anatomy. It's not just there on your face to look good, but what it does is it warms the air in before it hits your lungs, and it also filters out any sort of foreign particles or things like that as well. So you can imagine, I said before, inside our airways, we want a temperature of around 37 degrees. If we're breathing in really cold air outside, especially if you're breathing through your mouth, you've got 10-degree air entering your mouth and then hitting your airways that are 37 degrees. And it can be quite a shock to the system and cause that sort of muscle spasm. So breathing through your nose will increase that humidity. It'll warm up all the air before it hits your lungs, so you're not getting that shock of cold air. And then it also, like I said, humidifies. Things like the old steam inhalation, so getting into the shower and you can do your breathing exercises in the shower, or the old steam inhalation with the towel over your head can be quite useful as well. Drinking enough fluids. Some people might be on fluid restrictions, so drinking what you're allowed. But if you're not on a fluid restriction, trying to drink at least 2 liters of water a day and trying to limit your tea, coffee, alcohol, those sorts of things. And then finally, using a nebulizer. And again, this can be something that I think you're probably best discussing with respiratory physio. But inhaling through a nebulizer a mild salt solution like saline can certainly help add some hydration to your airways. And it's what we call a mucolytic, so it breaks up thick mucus. So if you've got sort of really thick secretions, this might be something that's useful for you. And again, some of the devices actually do attach to nebulizers as well, so you can do both of them at the same time. So again, not for everyone, but if you do have really thick, sticky secretions and you're interested in something like that, then I would discuss that with a local respiratory physio. Next slide, thank you. So just some general tips, and I think it's really important in winter that we watch for all the flare-ups. There's a lot of different sort of cold and flu viruses going around at the moment, not just COVID, but a lot of other, respiratory viruses going around. So making sure that you watch for flare-ups, you've checked your action plan with your doctor, you know what to do if your symptoms get worse, etc. So that's really important. A simple thing, again, breathing through your nose, but also maybe just wearing a mask or a scarf outside over your nose and your mouth. And what that does is it warms up the air again before you breathe it in. So it humidifies it, hydrates it, and warms it up a little bit. So wearing a scarf or a mask outside and trying to breathe through your nose. And then because a lot of us are spending a lot more time inside, it's good to just check your air quality inside as well. So things like avoiding smoke, looking out for mold, because that can sort of get a bit rampant when we're running lots of hot showers and things like that. Cleaning the filters in your heaters and your air conditioners, checking sort of any of your household cleaning items for chemicals that might be a trigger for you, dust, and then also like pet hair and things like that as well. So just doing a once over of your house and checking your sort of what may or may not be contributing to your air quality inside. And next slide, thanks. So that's sort of it at the moment, but I think it's good to have a think about what is normal for you. So what is your normal mucus production? Do you need to perform an airway clearance technique every day, or is it something that you think you just need to do every now and again? And then some homework for everyone is just to go and practice some huffing. So even if you don't need huffing at the moment, if you ever get a chest infection, you've practiced it then, and hopefully you'll be able to do it correctly if you ever need to do it. And next slide, I think this is the last one. Yeah, so we've just got some resources there as well from Asthma Australia, finding if you need to find a respiratory physio or a pulmonary rehabilitation program. And then there's some videos of different techniques as well on the bronchiectasis toolbox website. So happy to take some questions.
All right, thank you so much, Janet. That was fantastic. And we do have quite a few questions coming through, so thank you everyone for getting involved. I'm going to try and sort these into a few different categories to make it easier. So first of all, to do with huffing. So there's a few people who struggle to breathe very well through their nose. Is the breathing through the mouth okay when you're starting the huff?
Yes. Yes, it is. It's just nose breathing is preferable for the reasons that we spoke about. So we want to, it filters the air, it humidifies the air. So sometimes when people breathe in through their mouth to try and do a huff, it might irritate them a little bit depending on what's in the air. So they might find that they get a little bit irritated from that. But I would encourage you to try some of the techniques if you can't breathe through your nose, to try some of the simple techniques to clear your sinuses. And if you are unable to clear your sinuses and you still can't breathe through your nose, then I would see your doctor or potentially an ear, nose and throat specialist, because it's important to it's really important to be able to breathe through your nose. So I think that, yeah, pursue that a little bit more as well.
Absolutely. So this person knows someone who huffs with a bit more force than what you demonstrated. He calls it
Most
horse
people
breathing.
Yes.
Is there a reason why you shouldn't do that, or is there different levels?
Yep. So when you're going too forceful, what that often does is it collapses the airways down. So especially for people who have COPD, if they go too fast and too hard, the airways, instead of being nice and open, so like our tube, the pressure of the huff just squeezes it closed. And so it's kind of counteractive. You're not really getting the air flowing and those shearing forces to move the mucus. And I think that that's very, very common in the patients that I see. So I would say 80% of patients come to me and they do huffs far too forcefully. And so it's just taking it back, keeping this clear. I sometimes say make like a ha sound. So rather than like a C or a K sound where so we want to keep your vocal cords open. So say ha.
Okay,
Yes.
great. Yeah, so
Yes.
someone maybe needs a bit more training in their huffing would be more
Yeah,
effective.
yeah. And it's hard to practice because if you do too many at once, you'll get really, really dizzy. So try one or two, have a rest, and then go again.
Yeah. So someone's just been practicing during the webinar, but after attempting the huffing, they had a coughing fit. So they are a coughing asthmatic. Is that
Mm.
usual? Have they maybe done something not quite
Yeah,
right?
and that
Or
can happen. So sometimes if you breathe, again, breathing out too forcefully can trigger a bit of a cough. And because, like you say, with the asthma as well, can have very tricky airways. Sometimes we would maybe get you to huff into a device with some pressure to keep the airways open a little bit longer as well. So I would pull back a little bit on that and not go so forceful, and don't try and push all the air out. So trying to pull it back a little bit. So you could even just go to start with, and then go a little bit bigger, and maybe avoid that big huff at the end if it's going to push you into that sort of coughing fit.
yeah, so trying to go too quickly and too hard is not the best way
Yeah,
to
yeah,
make it work.
yeah. But again, everybody's different, so it's really tricky. But yes.
Mhm. Yeah. And are these exercises suitable for children as well?
Yes, absolutely. So the active cycle of breathing technique is probably one of the first things that we teach kids. But you can teach them things like blowing bubbles with the old stick, and blowing some bubbles, or a windmill on a stick, and getting them to blow through that while they're sort of taking a deep breath in and out. But yeah, it's often the active cycle of breathing is one of the first techniques that we teach kids, but
Oh,
with
that sounds like
toys,
a good
so
one.
that
Yeah,
try and keep them engaged. Yes.
yeah. Um, and are the PEP devices also suitable for children, or are they just for older
Yep.
adults?
Yep. But again, definitely need to see a specialist, be taught how to use it, because the pressures would be very different for children as well. So the settings that we would be putting them on would be different, and the pressures would be very different as well. So yes, yeah.
Yeah. And where could you get training from for the PEP devices?
Uh, any respiratory physio. So yes.
Yeah, so you just need to find a
Which is hard,
referral.
which I know is
Yeah.
very difficult sometimes to find. So
Mhm.
I think, yeah, you could contact, the local hospital as well. Sometimes they have physios, respiratory physios, who see patients there as well. So I do know it's difficult in private practice, but there's quite a few of them on the APA website. So
Yeah.
finding, yeah, specialist respiratory physio.
Yeah. And we've got that link on the screen
Mm.
now.
Yeah.
choose.physio/find
Yeah,
a physio.
and I think there's quite a few physios now as well who do a lot of telehealth consults as well. So that might be an option as well for people who potentially live in rural areas.
Yeah, fantastic. I've got a couple of questions about sinus. So if you have sinus issues as well as asthma, would there be any special techniques for that that would help?
Again, so any of the sinus sprays, sinus rinsing to clear those airways, but also then seeing your doctor or an ear, nose and throat specialist to see if there's any potentially medicated sprays that might be useful as well, and or potentially having a CT scan to actually see what's going on, but through your sinuses. But it's a very common comorbidity in people with asthma. And it is something that can be treated quite well. So I would try some of the simple things like saline sprays and rinses, but definitely seek out medical advice as well.
Yeah. Another similar one, so they get a very runny nose in winter, which makes the breathing far more difficult. They've tried antihistamines and they dry it up, which helps, but they don't want to use that every day. So would the
Yep.
suggestions be the same?
Yeah, you could try some of the sinus rinsing, because that can just help flush out some of the potential allergens that are causing that sort of drip. And again, trying to go to a doctor as well, because it might be maybe a medicated spray, which is better than probably taking oral antihistamines. That might do the trick as well.
Yeah. Um, There's another question about another sort of side issue, which is sleep apnea. So this person has sleep apnea, they've started a sleep machine trial, and they're
Mhm.
just wondering if that has been known to cause problems with asthma symptoms. They're feeling very congested every day, and
Yeah.
it's been going on for over a monmonth. Is that common?
Yeah. So what can happen in some of those machines is that you lose some of that dehydration. So you can make sure that there's a filter setting on it. You can add humidification into the circuit as well at nighttime. So you could talk to your doctor, your specialist about that. But it can be quite drying. So there is a humidification circuit, I think, that you can add into those machines that will help humidify the airways a bit. But it could be that because that drying effect of the machine. So
Okay, so
get
don't
into
give
that.
up. There's
No, no,
an
no.
answer.
And
Yeah.
potentially in the morning, if you're feeling really dry after being on it all night, like having a shower, trying some steam inhalation, just adding some more hydration back into the airways, because I think that's possibly where the congestion is coming from.
Yeah, great. All right, well, that worked out very well to lead into my next set of questions, which is humidification. So what do you do if your house is quite cold? Is it better not to put the heater on?
No, I mean, I love my heating. So I think, no, you've got to stay warm as well, but just trying to stay hydrated, using some of the other things like, your steam inhalation. You can buy humidifiers for homes as well, but it's really important just to make sure that you're cleaning them. They are a potential growth for mold. So making sure that they're clean and you clean the filters. But yeah, I would still continue to use your heating, but maybe add some humidification to the air.
Mhm. Thank you. And talking about the air quality, does an air purifier help in any way for that?
Yeah, well, they're everywhere at the moment, aren't they?
Mm.
Yeah. So it certainly can clear, especially, well, we've got them everywhere in the hospital at the moment, so because of COVID as well. But yes, they can clear a lot of sort of the common allergens and filters and things like that. But same thing, making sure that you clean the filters in them quite regularly. But yes, they can help with air quality.
Yeah. And I think you mentioned this before, but humidifiers themselves, like vaporizers, I guess, are they good for overnight cool air?
Yep, they're quite good just to, they add more humidity into the air, so a bit more
Yeah,
moisture. But again, making sure that you clean them because you have to fill them with water and then so just making sure that you're cleaning all those things so mold doesn't build up in it, because then it's just going to be pushing out mold vapor, which is not what you want.
gross. Yeah.
Yeah. So just making sure you're cleaning things properly. Yeah.
Yeah. Um, okay, so another a few more recent questions that have come through. So with swimming, are there things that you can do beforehand if swimming in cold water? I
Mm.
guess, yeah.
Yeah, warming up. I like swimming, but I don't like swimming in cold water. And it can be a shock to the system as well. So there have been some issues because cold water therapy is well, it's not a fad at the moment, but there is a lot of cold water. Um, it can help with immunology, but you don't want it to, like ice baths and things like that. I don't think for people who have lung disease are particularly recommended. I think it can be sort of a shock to the system. But if it's just sort of a normal cold pool, I would try and do some sort of warm up before you go in. So warming up your muscles, going for a walk, anything that's going to increase the blood flow, to your sort of peripheral muscles a bit more, just to get things warmed up before you get in there. But swimming is a great exercise because it teaches you breathing control as well. So you have to sort of breathe in, breathe out underwater, and you're almost like you're sort of blowing bubbles underwater, which is very similar to that positive expiratory pressure. So like some of those devices, so breathing out underwater, blowing bubbles, and then breathing in again. So it is a nice sort of breathing technique to help clear your lungs, but also sort of regulate your breathing.
Yeah, excellent. Um, so if someone's not great at huffing and they do have extra mucus from a viral infection, what should they try?
I would just do some deep breathing, some slow, deep breaths. If you're finding you're getting that sort of triggering, and that is very common with viruses, that you get that sort of really irritable cough rather than productive cough, then sipping on water, having a throat lozenge, just really trying to soothe the airways a little bit, just having some deep breaths, and even just doing like throat clearing, so doing a bit of that rather than trying to do the big huffs.
Yeah. Right, we're running out of time, so I'll just pick a couple more.
Yep.
Could you also use these techniques for a post-COVID cough?
Yes. So it just depends on whether it's productive or not. So often in a lot of the post-COVID patients we've seen, they're not particularly productive, so they don't have a lot of mucus. They've just got that really irritating dry cough. So most of that would be teaching sort of cough suppression and sort of things like, tucking your chin down, swallowing, and that can potentially stop that need to cough. But also the humidification and hydration, definitely. So with a lot of the post-COVID patients, we've been getting them to add some more humidification to their airways, just to suppress that sort of really irritable cough.
Mm-hmm. Yeah, so it's about the type of cough, I suppose.
Yeah, so if it's productive and you've got mucus, then all these techniques that we spoke about today are really appropriate. But if you've just got that really dry, viral, irritable cough, then it's more about adding hydration, sipping on some water, and trying to more suppress it. So coughing is only good if you've actually got something to clear.
Yeah.
Otherwise, it's very irritating for your body in general.
Yeah.
Yeah.
So we've got one lady here who's only been diagnosed as asthmatic in the last couple of years, still learning her triggers. Is there an average or minimum time to do the huffing? So would it be once a fortnight, once a day? What would be the
Really just
recommendation?
depends on when you feel like you've got something there. So it's more, if you've got some secretions, try and do a huff rather than a cough. And if the huff doesn't bring it up to the point where you then can cough or clear, then go back to doing what you're doing. So you can just do it every now and again with your exercise, but it's not something that you sort of need to regularly do unless you've actually got some sort of mucus there as well that it's tricky to clear.
Mm. I'll just pick one more because we need to wrap up. I'm sorry we won't get to everyone's questions. We'll try and answer them in a post later on. I've got a few people here who are mentioning that humidity seems to be a trigger for them, so they get more
Too
symptoms
much,
in
yeah.
humid
It's
environments.
it's that fine balance between enough humidity and too much humidity. So we don't want the air too dry, but we don't want it too heavy as well. So what we see in winter is mostly really dry air, which is why I sort of recommend humidification. But that's not something that necessarily people need to do in summer. And in fact, sometimes in summer it gets so humid that it can, it feels like you're breathing in like thick water air. So it's getting the right humidity. And unfortunately, in winter we tend to go more towards that dry side. So humidification might be something you need to use in winter and cold weather, but certainly not in summer because it can be a trigger.
Yeah, yeah. All right. Well, thank you so much, Janet, and everyone for
Thank
joining
you.
us tonight. We'll have to wrap it up there for time. We do have a short survey. I've linked it on the screen here, and I've also linked it in the chat. As I said, we really would appreciate you filling out the survey. We do look at every single response and use it to help plan our future content, our future webinars, our future classes. After the webinar, so in the next day or so, you'll get a recording of the full class. If you had any trouble with the slides tonight, you'll be able to see the slides in the recording as well. And you'll also get a link to our existing Breathe Better page where we have updated a new video to our huffing section in there as well. It's nice and short. We've got one more webinar planned with Janet on breathing after exercise, so that'll come up in spring sometime. So look out for us releasing a date on that. But otherwise, thank you so much for joining us, and we hope we'll see you next time.
Thanks, everyone.